somebody actually did research to find out if that was true. And there is a correlation. Now, remember, correlation is not causation, but you have the people with higher levels of gum disease or worse gum disease have higher levels of heart disease. And so the temptation that people have is to say, oh, heart disease causes gum disease, or vice versa. Gum disease causes heart disease. But the correlation is different than we might think. We should take care of our teeth. We should get rid of inflammation. If you have chronic inflammation, then you're going to have vascular disease. And if you have vascular disease, you're going to have heart disease. So why?
Hello and welcome to the Healthy Heart webinar. Getting us live here on Facebook. Hello, all of you on YouTube. We are so glad that you are here. We are on, you know what? I didn't check. I wanted to see exactly which episode number this was. Okay, so maybe 38. I believe this is episode 38. So if you want to catch up on past webinars, you can find them at bartonwebinar.com. There will be a link to our YouTube channel. And guys, we have this Healthy Heart webinar, but we also have a type 2 diabetes webinar that we do each week. So we probably have near 300 episodes of Dr. Saunders teaching us about health in our bodies. And so if you want to get a whole education on your body and your mind, on stress, on all of those things, go to the YouTube channel. I just highly encourage you. There's so much good information and it's free.
Yeah.
And it's coming from someone who is saying things that aren't trendy all the time. And he doesn't make a bunch of money from telling us to eat the right things. So that's how you know it's probably true, right? He's not getting,
it's not.
I better stop. Anyway, we want this to actually stay posted. So anyway, hello, everyone. Welcome to the Healthy Heart webinar. I'm just going to check. Okay, so if you have questions as we're going through the webinar, feel free to post those in the Q&A. We also have the chat available as well for you guys to say hello and let us know that you are here. Anders is here. It's so funny, Anders. Yesterday or 2 days ago. No, it was yesterday. Jude says to me, Mom, whose car is in our garage? How many days has that car been there? And he just noticed yesterday. Andrew's car was at our place while they were traveling. So it was kind of funny. Roy is here from Colorado. Hello, Ryan Callie, back in the house from Valley Springs, South Dakota. What is up with all this snow? Again, Ryan, this is not fun anymore. We just got, I don't know how many inches of snow, and now it's snowing again. Hey, Fred and Eugene are back. Awesome. I love that you guys keep coming back. We feel like a family now. Doesn't it feel like a family? Like, oh, my people are here. And we're sharing like intimate health details. So this is fun. We don't do that with our regular family all the time. So this is special.
I know,
right? David from Colombia. Awesome. Judy's back from Kansas. Christine, Florida. Lloyd, how are you, Lloyd? I think about the little chat that we had, and you showed me around your place, and that was so cool. Let me see. Mary is here from Iowa. All right. Hey, the Garcias are here.
Oh, hello, Garcias.
What's up? Were you guys on the webinar yesterday? I want to say Dr. Saunders gave a shout out about Barbie, if I remember correctly. I can't remember what about, but it was something.
Something yesterday. Oh, about going back to phase 1 after being on phase 3 and saying, I need to go back to phase 1 to get to normalize everything again. Yeah.
Yeah, it was awesome. Okay, Tom is here from Eugene. We got so many people on here, you guys. John is here. I'm going to waste time going through all these, but it's so fun. I love to see this. Peggy from Florida, from Cheryl's home state. Well, I guess you didn't grow up there, but you're there now.
10 years.
Marion, you have snow also. Ugh, yeah, I feel that. Ted, hello. Okay, that's a good perspective, Judy. Judy's saying nice things about the snow. That's good. Julie's back. Hi, Joyce. Gail from Alberta. Okay, all right. Here we go. We better get started. I'm so glad that you guys are all back. I mean, that means we're doing something right if you guys keep coming back each week, right? Well, I'm not, but Dr. Saunders is, and Cheryl is.
Yeah.
So we thank you. Guys, today we're going to talk about keeping our heart healthy and also the importance of keeping our teeth healthy. And I'm just curious about the correlation between our heart and our teeth. I remember hearing things about, oh, make sure you're flossing. It prevents gum or it prevents heart stuff. And I don't even know where that came from. Was that a myth? Did someone just tell me? Was that a trick that like my parents told me I needed to do so that I would floss or what? Dr. Saunders, is there any truth to this?
Absolutely. That was kind of a surprise when somebody actually did research to find out if that was true. And there is a correlation. Now, remember, correlation is not causation, but you have the people with higher levels of gum disease or worse gum disease have higher levels of heart disease. And so the temptation that people have is to say, oh, heart disease causes gum disease, or vice versa. Gum disease causes heart disease. But the correlation is different than we might think. We should take care of our teeth. We should get rid of inflammation. If you have chronic inflammation, then you're going to have vascular disease. And if you have vascular disease, you're going to have heart disease. So why does this chronic inflammation cause vascular disease? Well, there are several different things that are going on in that. Remember, we talked about the blood vessels and the arteries have a lining on the inside, on the very, it's called the endothelium, which is the skin inside, is cells. And those cells make something that is miraculous. It is so remarkable, you would be amazed. It's called glycocalyx. And glyco refers to their sugar molecules, but not sugar like glucose or sugar like fructose and galactose. And so this glycocalyx is kind of like a soft fur or a gel that lines the inside and makes everything flow smoothly. So instead of having resistance on the outside so that the blood flows slower on the outside, your vessels don't have that. Your vessels have a glycocalyx, so the blood just goes right through, all the way through, and it just flows constantly. And there's no what's called laminar flow that you get with pipes, for example. Your blood vessels are not pipes. What does that have to do with gum disease? Well, if you have inflammation, there's a couple of things that you don't do well. Number one is you don't make that glycocalyx very well with inflammation. So you don't have good blood flow. And if you have areas in your body where like the blood vessels curve around, so when any fluid curves, when there's a pipe or something, whenever there's an elbow in the pipe, the water fluid, in this case blood, comes in and has to turn, and that process of turning puts a lot of pressure on that part of the pipe. Does that make sense? That you have this excess pressure on there, and that's going to cause sort of a wearing away of that glycocalyx in that area. And if you're not really good at repairing that glycocalyx constantly, if you don't have enough of the sugar molecules, if you don't have the fructose in your diet, if you don't have the right bacteria, and we'll talk about that a little more in a minute, then you don't repair, or you don't make that glycocalyx, you don't repair it very well. So you start getting the wearing away, and then you get clots forming, because then you have exposed endothelium. You don't have the glycocalyx protection anymore. So that exposed endothelium causes you to make clots. And when you make clots, then it comes and paves over and makes atherosclerosis inside, and it gets thicker and thicker and thicker and thicker. And there are, when biopsies are done of these kind of clogs in arteries, they can see under the microscope the layer upon layer upon layer upon layer upon layer of the clots that form from areas in the where the blood is pushing against the arteries. And it's especially common in the carotid arteries. Ooh, that's neat.
Yeah, nice.
Wow, that's a great picture. Okay, so the endothelium. And so those clots form on the inside, cellular debris and all that stuff. And then there's a cap that goes over it, and your body paves that over with endothelium so the blood can continue to flow, but it gets narrower and narrower with time. So if you have inflammation, then you end up with this damaged endothelium that doesn't repair because you have all the inflammation. That's where the problem comes in. So if you don't have inflammation, then you can repair it well. Well, guess what gum disease is? It's inflammation. And it's a specific kind of inflammation. It's bacterial inflammation. And so here's the strange thing about it. Every time you brush your teeth and floss your teeth, you're getting bacteria from your mouth into your blood. It's getting into your blood, and it can cause infections, it can cause abscesses, and it can cause inflammation in your blood. So your gum disease is actually not just isolated in your mouth. It doesn't just stay in your mouth. It gets into your whole body and causes inflammation. So, you think that something is isolated. The body doesn't isolate anything really very well. If your toe hurts, it even says that in the Bible, right? If one part of one member of your body hurts, then the whole body's in pain and the whole body suffers. And that's pretty much what's going on here. You have one little part, one tooth abscess or gum disease, and your whole body is suffering. And it shows up as vascular disease is one of the things this inflammation shows up as. And of course, if you have vascular disease, then heart disease. And it's common in the carotid arteries. So the bacteria, let's talk about those bacteria. Why do you have bad bacteria in your mouth? Why do you have bacteria that cause inflammation? It's because you're feeding them. Whatever you feed, that's what you're going to get. And so if you're feeding bad bacteria, that's what you're going to get, bad bacteria. How do you feed bad bacteria? Well, simple sugars is a good way to feed bad bacteria. Another simple way is to eat frequently or constantly. It turns out that you need some periods of time when you're drinking water, washing down this bacteria, and you're not feeding it anything. So I know people who won't drink anything that doesn't have flavor in it. And so everything they have has to have some kind of flavor in it. And if it has artificial sweeteners, often those kill the good bacteria. The good bacteria will take up those artificial sweeteners as if they're sugar. Look, sugar, but it's not sugar. It's sucralose or some alcohol sugar or something. And they get toxic from it, so you kill off those bacteria. So it throws off your balance of bacteria in your mouth. You don't think about that, but there is a balance of bacteria in your mouth. And so having a period of time of not eating, not feeding the bacteria, guess which ones die first? Well, the bad bacteria die first because they're not getting any food. The good bacteria they last longer. And your mouth, your saliva actually makes food for them. I know that sounds weird, but yes, you are feeding good bacteria from your saliva in your mouth that you have when you're not eating. So one of the ways to get rid of gum disease is to fast or not eat and just drink water and just wash it down. And of course, brushing your teeth is a good idea, cleaning your teeth, getting all the food off, because that food is going to grow not just good bacteria, but it's going to grow bad bacteria too, right? So brushing and flossing is a good idea. But less frequent eating is a better idea, and avoiding especially sucrose, sugars, is a good idea. And there's one other thing, and that is that you feed the good bacteria with fiber. And we don't think about this for our mouth, but the fiber, the things that we're chewing on that have stuff that we don't digest, what we call soluble fiber, is feeding good bacteria in your mouth too. So high fiber diet, which will also feed the good bacteria in your intestines and lower inflammation. So remember, it's not just in your mouth. All of this is going down and feeding your good bacteria in your intestines. Brush your teeth, floss, go for a long periods of time without eating, like have 5 hours between meals where you have no snacks. And if you drink anything, if you're thirsty, drink water, plain water, nothing in it. No lemon squeezers, no Kool-Aid, none of that
Is
stuff.
Kool-Aid still around?
Yeah.
Yeah.
It's still around.
Okay.
Yeah. I drank the Kool-Aid. That was a long time.
So, I mean, I feel like, is there anything that fasting can't do at this point?
Okay, everything good in your body happens when your stomach is empty and you're not eating. Eating is necessary to replenish nutrients and all of that. But most people use eating for emotional reasons and not really for nutrition. And I had that just the other day. There were a bunch of oatmeal cookies around, and I'm like, oh, oatmeal cookies with raisins in them. I love oatmeal raisin cookies. And so I ate one, and after I ate it, I thought, you know what? I didn't need that, and that wasn't for nutrition. It was just for taste, for my emotions. But you know what? That's part of life, right? It's overcoming that.
Right. Guys, how many of you have been taking us up on our challenge over the past couple of weeks and really implementing more fasting? If you have been, let us know in the chat. Let us know how it's going, what some of your takeaways have been that you can share with us. I know some of you had started, and we have had a few of you on the webinar who are like 72 hours into your fast. You're fasting a lot, which is awesome. And I would, speaking kind of teeth and gum stuff, I have heard of people who have reversed cavities by, for example, oil pulling. And so where you're taking like I think a good coconut oil and swishing it around in your mouth for a while. You don't just do it once. You do this over the course of time. You can look that up. But I'm kind of wondering, I wonder if fasting can reverse some of this also. Is that possible? Cavities? What do you think?
Gosh, I don't know. You know what? I don't know enough about cavities. If you talk to a dentist, and I have talked to dentists about this, they say, "Oh no, once you have a cavity, there's nothing you can do about it." But there's a dentist called biological dentist. There's one in Santa Barbara that I talked to, and she says, "Oh no, teeth are living tissue like bones are. You know, bones aren't just rocks." But dentists are taught in dental school about the teeth being just rocks in your mouth, I don't know enough about it to be able to say whether you can actually reverse a cavity or anything like that. I'm sure it's possible.
Yeah,
I think they've used remineralizing powder as part of the process to keep new minerals to build up the cavity with new teeth by using minerals. That's what I've heard.
That makes sense. Interesting.
Mm-hmm.
Okay. Again, let us know about your fasting if you were doing that. We'd love to hear from you. You can post that in the chat. I'm going to ask a question here from Christine. Christine is new to this group. I had a coronary calcium scan recently. Before I finish, tell us what that is.
Okay. Coronary calcium score is a test that I recommend to anybody, over 50, or if you have any like issues, if somebody says, "Oh, you need a statin," or your cholesterol's high, or your blood pressure's high. I had somebody last week, her cholesterol from the time she was in her 20s and 30s, her cholesterol has consistently tested over 300. And that's high even by my standards. That is actually high. And so we decided to do a coronary calcium score, and her score was 0. She had no calcifications in her arteries in her heart at all. So she doesn't have a heart disease. She doesn't have atherosclerosis in her heart. So a coronary calcium score is it's a CT scan that they look at all of the arteries on the outside that are feeding the heart, and they know all the arteries, the left main, the left anterior descending, the right circumflex, they can see. And so they can see where the arteries are, because they get a 3-dimensional image of your heart. And then they give you a score, which is how much calcium is deposited inside those arteries. And that score is a marker for how much atherosclerosis there is. So it's a sign of inflammation. It's a sign of atherosclerosis. And I've had people anywhere from 0 to 7,000. Over 400 is high for someone who's age 60 to 70. Over one or around 100 is kind of average amount. 0 means you don't have a problem. You don't have heart disease. So if you have any, so I'm interested in what her coronary calcium score is.
So, okay, Christine said she had the scan recently and the score was 78 out of 100, she thought. I was told that it's irreversible. Is that true? Also, fact that my lipid A is high is a genetic marker. Is it a fact that a high lipid A is a genetic marker?
Yes. Okay. Lipoprotein A is a genetic marker. And we've talked about that on the show. So you can go back, because we've gone extensively about lipoprotein A and why that's important, and what to do about it. So if you have a high lipoprotein A, the best thing you can do is get your omega-6 to omega-3 ratio around 2 to 1 would be great. And that would be the best protection you could have. So then back to the coronary calcium score of 78. 78 means you have atherosclerosis in your arteries. I don't know how old is she?
I'm not sure. Okay, here's another comment from her there. Oh, yes, I'm just going to read this too. It says, I have Graves' disease. Oh, Christine is 71.
71, okay.
After RA twice, I'm now hypothyroid. I read that I have to be careful with fasting because of that. Is that true? Okay.
And RA is rheumatoid arthritis. Just for those.
Is it? Yeah. Okay. So having rheumatoid arthritis is an inflammatory condition, which is going to contribute to problems like arterial disease and that kind of thing. So you're going to see that. 78 is actually not bad at age 71. You're under 100. So you all they do is it's a comparison to other people. So that 100 number is kind of average for a 70-year-old, and that's what they're saying. It's not 78 out of 100. Ideal is still 0. You want 0, but 78 is not so bad, and it's doable. It's something you can work with. Now, the questions were, is it really reversible? And the answer is yes, it's reversible. But apparently, there's research to show that vitamin K can take the calcium deposits out of the arteries and put the calcium into the bones. So it takes calcium out of soft tissues, which includes the arteries, and puts it into bones. My experience is that I haven't had people do that. I've always seen progression when people for a year, they're taking, their vitamin D, vitamin K, magnesium. So they're trying to build bone and take the calcium deposits out of their bones. So they're getting pretty high levels of vitamin K. I give them 300 micrograms a day, or about 2 milligrams a week. And my experience is, even though the research shows that it's possible, that it doesn't change it, because when we do another coronary calcium score, it's usually worse. It's progressed, from 70, now it's 100. Actually, the one that was 7,000, he was 5,000 something before. And then we put him on this strict program of everything. Let's see if we can reverse this. And he goes, okay, I think I got it. He's no more chest pain. He's doing great, functioning well. And he goes, I want to see. And so we did the coronary calcium score, and it was 7,000. So wow. I just rolled my eyes and go, well, you're more functional. So he was very distraught. He was so depressed because, it's frustrating to work so hard. That's what he said. I work so hard for this, and it's not, the numbers aren't any better. And I said, yeah, but your function is better. It's okay. And he's like, yeah, I know, but I wanted to see better numbers. I wanted to rub it in my cardiologist's face.
And Julie asks, it's in synochroma, right? It's in synochroma, right? So there
Yeah,
is 300 micrograms of vitamin K in our synochroma supplement.
correct.
Awesome. Christine says, thanks, some hope. Finally succumbed to low dose statin, taking vitamin D with K and other supplements. All right. Julie also said that she saw a holistic practitioner and he thought I had more inflammation. So he prescribed a certain type of vitamin B. I do have gum recession. I suppose good gut bacteria is also good mouth bacteria.
Very good. Yes, yes. Yeah, I didn't emphasize that enough, but that's actually true. That's a real thing. And so fasting also, when you fast for long periods, like 3 days, it changes your gut bacteria to a very good. You have like a lot of good bacteria and very little of the bad bacteria. It takes the people that have like colitis, chronic colitis, it takes the bacteria away from the lining of the intestines. So yeah, it works both ways. Good mouth bacteria, good gut bacteria, and those are the same things: eating good fiber, fasting periodically, and avoiding the sugars and starches that feed the bad bacteria. So what was the other thing? There was another thing she said about that. The question she
Trying to
had
think
was,
where I had it. Okay. Oh, vitamin B being
yeah,
used for inflammation.
yes. Okay. So some people with gum disease have a folate deficiency, and there's actually been a mouthwash that with folate that you can swish around folate, and it heals up the gums in a week. It's like people that have really bad gums, they'll heal up really quickly. Yeah, it makes a big difference having that B vitamins, especially the folic acid.
Interesting. Okay. John says I have been doing the 6-10-8 fasting for 16 straight hours. Today after breakfast, I did a brisk walk for 1 hour. I tested my blood sugar afterwards. It was 80. Yesterday after my 1 hour walk, my blood sugar was 74. Will walking 1 hour every day help me to lower my blood pressure and help my blood circulation in my feet? I'm 5'10", weight is 155. 69 years old.
Oh yeah, great. No, absolutely. Walking helps manage blood sugar, helps manage your blood pressure, and improves circulation. All of the things that you're looking for are going to be improved by walking. It's hard to overemphasize the benefits of walking. So I often recommend people get some kind of monitor and keep track of their 6 to 10,000 steps a day. 6 to 10,000 is 3 to 5 miles a day.
Okay. Julie said, so there's no good sweetener like a natural stevia or monk fruit or anything like that, right?
Well, they're okay if they're used intermittently, periodically. It's the people. The issue we were talking about with the mouth is the people that are continuously drinking, and they never drink plain water. They always have something in it that has to be sweet or flavored in some way. And so what I was saying is avoiding that so that you're not growing any bad bacteria and you're not messing up your insulin sensitivity or killing off, because a lot of those artificial sweeteners do kill off good bacteria. And so I don't know.
I'm looking here. David said that he has been mostly stopping eating by 5 p.m. until 8. So a 15-hour fast, and it's seeming to help. Awesome.
Yeah, that's great. There's a lot of evidence for that. That is remarkable.
David, I'm curious, how is it helping? What things are you noticing that are different? So, I was listening to the diabetes webinar, And you guys have talked about doing like case studies, having people write in their lab results, and then Dr. Saunders could review them. I would love to see, maybe if you guys are going to do that here on the Healthy Heart webinar as well. People send in their stats. You've done a little bit already just today, but actually review a certain case, and then people could actually have a kind of like a consultation with Dr. Saunders, but then other people could learn from that, send in their own information. I hope we can do that.
I did have someone send me all their information already with the hopes that we
Really?
were going to do that. So yeah, I know. I think it'll be really exciting. I'm actually going to pull up my email if I can get it to her, because I know I got some things that came in that way as well.
Well, and
Maybe
David just replied, my blood sugar is better and my AFib is less. So in the 50-hour fasting window, that's what he's seeing different. That's amazing.
That's great.
And oh, go ahead. Oh, I was just gonna say, while you were looking your email up, Whitney asked the question, what about coffee and unsweetened tea?
Okay, so so you could, while you're fasting, there's some pretty good research to show that if you have unsweetened tea and coffee with nothing in it, black coffee without any sugar or a creamer or anything in it, that doesn't break your fast. So actually, it's probably okay. So what they talk about, who was it? Jen Stevens wrote a book called Fast, Feast, Repeat, and she's the one that started the idea of the clean fast, because everybody else does a dirty fast. If you even look at, like, people are spending $250 for a kit called a fasting mimicking kit, and it's a dirty fast because they're drinking drinks with that are sweetened with glycerol. They're eating little nut bars and nut date bars, and so they're like eating throughout their fast, and every time they eat, they're going to release insulin, and it's breaking the fast. So in Sachin Panda's book, The Circadian Code, he explains that even 1 gram of sugar, 1 gram is about a quarter of a teaspoon of sugar, is enough to break your fast, to turn on all the machinery for digestion and all of that, and mess up the empty stomach issue. So the thing about the drinks is to just drink water, because that doesn't mess up your fast, and black tea and black coffee is okay.
Okay. Ramona had sent me a message that says, what does it mean when the cardiologist wants to order a DVR-20 test?
I don't know. I don't know what a DVR-20 test is.
I don't either.
Look it up.
Yeah.
Okay. And then also there were some other good questions in here too. Oh, I lost it.
Antonia asked, please tell me who is the author of the book. Well, he mentioned 2 books, Fast, Feast, Repeat by Jen Stevens. That's Gin Stevens. And the other one was Circadian Code by Sachin Panda. That's for Antonia. Ernest asks, what about adding collagen to coffee?
Oh, no collagen either. No, that's have collagen only during eating time. So in your eating window, collagen is okay, because it's a protein and it will stimulate insulin production.
Good question here from Ramona also. Which health insurance plans cover holistic health? Are there any?
Right. Very few.
Yeah.
Very few. I actually take insurance, and so most of my patients have some type of PPO insurance, Medicare, or something like that. And so they cover what I do, but they don't cover what I do. They just cover the parts that, like, if I have a visit with somebody, then, and I don't tell them what I do. Well, I just have we were in a visit for 20 minutes or an hour or whatever, and then I bill the visit. And so they'll cover that, but they don't. But like yesterday, I ordered a couple of tests on people, and they won't cover the tests, the holistic kind of tests.
Let's see. Ramona also had some other questions. Which practicing cardiologists in California are interested in using holistic approaches at UCLA Medical Center or USC or other medical training schools? Or which alternative centers do you recommend in California for arterial cleansing and monitoring of atrial fibrillation?
Oh, wow. Okay. There was, I don't remember his name. There was a cardiologist in the Valley in Los Angeles, in the San Fernando Valley, that one of my patients went to. That was an organic cardiologist, somebody who actually was more of a functional cardiologist. But there aren't very many. Cardiologists are so narrowly focused on the heart that they really are into whatever the current medical establishment says. And so it's kind of interesting. Even the ones that are interested, like I talked to a cardiologist in Santa Barbara, and he said, "Boy, I wish I could do what you do." And I said, "Well, why not? I do it. You could do it." And he's like, oh no, not in cardiology, because you will get booted so fast if you don't do everything, if you don't bully people into taking cholesterol medications and blood pressure medications, then you'll be ostracized, you'll be a pariah. And I go, yeah, I know what that's like.
Yeah. Good question here from Ro. Why can you not take vitamin K if you are on blood thinners?
If you're on blood thinners, you can take vitamin K. If you're on Coumadin, then you have to be careful with vitamin K. It doesn't mean you can't take vitamin K. Coumadin blocks vitamin K. So if you have vitamin K, so for example, if you're eating greens a lot, or you like natto, or then you're going to get vitamin K. So when you're on Coumadin, you have to check all the time. You have to check your bleeding time. Your INR is called. And so if you're eating vitamin K, you're going to have to take a higher dose of Coumadin to block that vitamin K. So that's why they say really avoid vitamin K. You're going to get some, but if your diet is pretty consistent, then your dose of Coumadin isn't going to have to change all the time. I don't recommend Coumadin, by the way, and most cardiologists don't now either, but it's still around and people are still using it.
Robert says, is there a natural replacement for Eliquis?
Oh, well, be careful with Eliquis. Find out why you're on it and why you need it and what your options are, because in some cases, that's a blood thinner, by the way, Eliquis. Some people have like artificial valves and they're gonna have to be on a blood thinner, and so changing to something natural may not be your best option. If you're having reactions to it and you insist on doing it naturally, I have found ways of dealing with that. There's a book actually, Stephen Sinatra, Stephen Sinatra, wrote a book called Reverse Heart Disease Now. And he talks about that, how people with atrial fibrillation that are taking Eliquis could go on a natural, it's called lumbrokinase, nattokinase. These are clot dissolvers. They're enzymes that dissolve clots that you can take orally. And then making sure you have enough vitamin E and fish oil, omega-3 oils, and balance those omega-3 oils. And so he says you can do that. So I would refer you to the book to get the details of who would be a candidate for that and who would not.
Okay. Paul says, I'm 72 and I've had AFib for 12 years. I'm taking sotalol,
Yeah.
which seems to work well, but I would prefer to become non-dependent on any prescription drug. Is there any hope that the diabetes regimen can help me weaning from sotalol?
Okay. So sotalol is a beta blocker, and it does one thing: it slows down your heart. So it blocks the what are called beta receptors that cause your heart to speed up, and it blocks that so that it keeps your heart beating slow and prevents the fast contractions of the heart because it slows it down. What that's supposed to do is to help you to stay in rhythm, but also if your atrial fibrillation is causing irregularity, if you slow it down a little bit, then there's more time for the heart to pump all of the blood out. So you'll get actually a better ejection fraction. So those are things to be concerned with when you're talking about getting off sotalol. The diabetes kit should help. Exercise can help. So atrial fibrillation is a problem with not having enough energy in the heart. So you don't have enough mitochondria. Normally you need like 40% of every cell needs to be just packed with mitochondria that are making energy constantly. So because, it's got to beat every second, and it can't stop. You can't rest. Try that with any other muscle in your body. Try lifting even something like this every second, lifting it up. How long do you think you can do that? Even though it's my phone's really light, it's a couple pounds, but I'm going to get tired and I'm going to have to rest after a while, right? The heart never gets to rest. So it has to have all those mitochondria in it. So when you get fewer mitochondria, then what happens is it takes longer to relax. And so the beats start becoming irregular, because some of them are longer, some of them are shorter, and then they don't work together anymore. So the way around this is to increase the energy of the heart, and we talk about that in the Healthy Heart Solution Kit. One of the things one of the chapters that we have in there is how to increase the energy of your heart. Of course, everybody wants to know what pill they can take to increase the energy of their heart. But the key really is exercise. It's increasing exercise, just gradually increasing your exercise. But at the same time, yes, you should take the supplements so that you can increase the mitochondria. And that's what coenzyme Q10, L-carnitine, magnesium, and ribose allow you to make more mitochondria. They can reproduce so that your cells have more mitochondria available in them.
All right, I was going to ask a question here. Let's see. Oh, it was something about the thyroid. Okay, hold on. I got to scroll up. I typed something in the chat, and then I lost my spot. Okay, nope, that's not it.
I'll ask a question from Nikki. Yeah. What are your thoughts on using inositol for diabetes and blood pressure?
Inositol is what we make it in our bodies. It was thought at one time to be a B vitamin. It's really good and really useful, and most people make enough. Some people do not. So you can get it in your diet. Usually, if somebody's going to try something like that, I'm going to say try it. How do you feel on it? How do you feel off it? Does it make a difference?
All right. Marion says, I have been on only one medication, Synthroid, for my thyroid. I'm sincerely hoping to get totally off this medication. What can I do to have my thyroid healed?
Okay. So the first thing to do is find out why. Why is the thyroid a problem? Why are you taking Synthroid? Sometimes you never had a thyroid problem at all. In fact, I've had like 30% of the people that come in on thyroid medication, I find never had a thyroid issue at all. That they had a lack of energy, they were cold, they had constipation for totally different reasons. And it's usually an adrenal problem. So sometimes if the adrenal gland isn't working, or if you have an excessive amount of stress, then there's an enzyme that converts your T4, which is the inactive thyroid hormone, to T3, which is the active thyroid hormone. And that enzyme, called a deiodinase enzyme, is blocked by stress. And so somebody under a lot of stress will have low thyroid, just because they're not converting the inactive to the active form. And so then they get put on thyroid and they say, you have to take this the rest of your life. Well, that's not true. So the first thing you need is testing. Find out why your thyroid is low, or if it's low at all. And another test is to go off the thyroid. If you go off the thyroid, and I had somebody do this, they went on vacation, 2 weeks, forgot their thyroid medication, and since they were in a foreign country, they couldn't get it, and so she went for 2 weeks, and she goes, well, my vacation was fine. I didn't notice a difference. So I said, okay, you're done. You don't need it. And people sometimes do that. So testing, find out why. And if there's no good reason why, then the next test is to go off it and see how you feel. Mm-hmm. I've had people go off it and say, wow, I got constipated. I was cold. I was hating life. I couldn't get out of bed in the morning. So I go, okay, go back on it. And they do.
David on Facebook says, I have 0 calcium and minor plaque. Is that reversible?
0 calcium in the coronary calcium score, I'm assuming. And minor plaque, what does that mean? Like in the carotids or plaque otherwise? If you're, I don't know, if you're in your 70s or 80s and you have 0 calcium minor plaque, that's awesome. If you're in your 30s, then yeah, you should do something about that. So it depends, but 0 calcium is a good sign, meaning so far you haven't developed any atherosclerosis.
Dal said, I recently underwent a stress test approximately 3 months ago and was told that my heart was strong with no issues. However, last week in a medical screening for acceptance into a medical study to observe the effects of exercise on health, my ECG result was abnormal based on T-wave inversion. I must now return to the cardiologist to be cleared. So I would like to know what foods and supplements as well as fasting regimen you can advise for T-wave inversion due to ischemia. Thank you in advance.
Okay. The next thing before looking at treatment, so it's a common issue that we have, especially in cardiology, to go from symptom to treatment without going through the middle part, which is why. Why do you have that symptom? What is the T-wave inversion? And is it cardiac ischemia? If you had a stress test that was normal, then there's no evidence of a fixed lesion, so there might be something else going on. So doing a coronary calcium score would be good. If the cardiologist puts you on another treadmill and says, nope, you're good, that doesn't mean you're good, because the treadmill is not an accurate test for determining whether you have vascular disease or not. It's not a good test for determining whether you have heart disease or not. So, I think that the cardiologist would have seen T-wave inversions if that was the issue before, when you had a stress test. And there would be a reason why you had the stress test too. I mean, were you having chest pain or something like that? So the next step is testing. Find out why, what's going on. So coronary calcium score is going to be helpful. Do you have atherosclerosis in your arteries? And then looking at your Lp(a), lipoprotein A, looking at your ApoB, looking at your inflammatory markers, diabetes markers, hormone markers. So looking at all those and finding out where your, and omega-6 to omega-3 ratio to find out where your risks are, or if there are any problems at all.
Okay, Christine says, what's the difference between AFib and heart flutters, where they go up and down like a whoosh? Supposedly my test did not show AFib.
Oh, that's a great question. Okay, so both atrial fibrillation and flutter both cause rapid heartbeat. And so you can feel oh my gosh, my heart's beating out of my chest, and it's like 150 or 200, or 200 is really high, but it gets up there, pretty high heartbeat. But the flutter is a regular heartbeat. It's beating regularly. And whereas atrial fibrillation is beating irregularly. And so that's the difference.
Tricia had said, what kind of test do I need to check my thyroid?
Okay, so to test your thyroid, T3, do the free T3. So you have total T3 and free T3. Just do the free T3 and free T4, the TSH, thyroid stimulating hormone. And then if you had any possible issues of Hashimoto's or autoimmune thyroiditis, it's actually very common. And so I put those tests in anyway. It's called TPO, thyroid peroxidase, and it's just known as TPO. And it's antibodies. So this is autoimmune disease. And the other one is thyroglobulin antibody. And those are the basic tests that'll tell you the function of the thyroid. So from that, you can see, if you say, well, I have normal T4, but my T3 is really low. Oh, you have a block in deiodinase enzyme. So that's often due to adrenal stress. And so then you can look at your adrenal glands. If you have low T4, that means your thyroid gland is not putting out enough. And then you look at the TSH, your TSH is bumped way high, and then you go, oh, the brain is saying, hey, make more thyroid, and the thyroid gland isn't listening. So those are the tests that can give you at least the beginning part of what's going on.
Christine said I had heard as far as cholesterol that the LDL particle size is more telling than just the lab numbers.
Yes, actually it is more telling. And a lot of people look at the details of that. But if you look at the inflammatory markers are much more. So this is one of those straining at a gnat and swallowing a camel kind of problems. The little bit is the LDL particle size and the apolipoprotein B, which is the number of particles of LDL particles, and the LDL levels. All of those are a minor part. The much bigger part is lipoprotein A, which is a genetic marker, for example, or your omega-6 to omega-3 ratio, which is like 10 times more important than the LDL particle size. So yes, you can do those, and it is more telling, but remember, there's not even a correlation of LDL to heart disease. We talked about this a lot. The AI, when they put 500,000 people into a computer and asked the question, okay, what are the markers or the risks of heart disease? LDL was number 46 out of 48. It was really kind of like nothing, it's meaningless. So that's what I mean, straining at a gnat and swallowing a camel. And you're missing the important things, which are like omega-6 to omega-3 ratio, and exercise, and lipoprotein A, and autoimmune disease, and gum disease, and diet, and all that. Fasting, important stuff.
Speaking of fasting, you might have already mentioned this, but Christine wanted to know if it's true that black coffee does not break your fast.
We're told that, and if you read Jen Stevens, has a pretty good blog on fasting, and she says that you can still do a clean fast with black coffee. Yeah, and the evidence is that it probably doesn't. Even Sachin Panda says that you have to actually eat a calorie, so like 1 gram of sugar is enough to break your fast, but not a cup of black coffee.
And last, when we were talking about fasting, you said something about the taste of bitter is actually good for when you're fasting, or it's neutral.
Yeah. Like sour and bitter are just like water. They don't mean anything. They don't cause a release of insulin or anything. Yeah, isn't that interesting?
This is going to be a big question. This might be our last question, but Connie says, being a diabetic, what supplement or what can I take to strengthen and make my kidneys function normally?
Oh, great question. Okay, so diabetes, on the diabetes webinar, we have one on kidneys that we went into detail about this and how to make the kidneys function. So if you go to Barton Webinars and you go to the other one, the diabetes one, or we call it the diabetes webinar.
Fixed blood sugar.
Fixed blood sugar webinar, yeah. Then you can look up the one about that has the kidney stuff on it. But basically, the best way to protect your kidneys is to get your blood glucose down to normal. And you want some hypoglycemia. You want your blood sugar to go low. Because if it goes low, then you make more glucose transport proteins that allow sugar into those kidney cells. Kidneys do not store sugar. And if they don't have a constant supply, they're going to die. And that's exactly what happens in diabetes. They don't have a constant supply. The blood sugar is going up and down, and they have fewer and fewer glucose transport proteins. So if you can keep your blood sugar low, getting the insulin resistance down, then when the insulin resistance is going down, that means the number of glucose transport protein is going up. And that's how you protect your kidneys. Now, there's one other thing, and people will tell you about the alkaline water thing and how you can protect your kidneys with alkaline water. There is actually a lot of research on that, and it looks pretty good. So much so that I would recommend a half a teaspoon of baking soda in water. Now, it doesn't mean you have to run out and buy a $5,000 machine to make alkaline water. Actually, that research isn't really very telling compared to the research that just uses a half a teaspoon of baking soda and water every day to start your day.
Okay, I was on mute because I was looking for that webinar and I found it.
I think you posted it, but it's at episode 212. Is that the one?
Yes.
Yeah.
Yes, episode 212. Awesome. Okay, we're on one more question. If you wanted to get your omega levels checked, how would you do that?
Yeah, you kind of, well, there are testing places that will do omega-3 where you don't have to have a doctor's prescription, but it depends on the state. Some states require it, like New York, absolutely you have to have a doctor's prescription. So, and it's just an omega oils test, and they'll give you an omega-6 to omega-3 ratio on that test. And I know like Boston Heart does it automatically. Otherwise, like if I go to Quest, I have to specifically ask for the omega oils test.
Okay, can I do one more question and then we'll be done?
Sure.
Okay. Genevieve says a family member recently died of congestive heart failure. She had just been given a clean bill of health 2 weeks before from a physical. I'm hearing more of ones dying soon after being given a clean bill of health after physical tests. What are your thoughts? And also, I better say, we can't say any of those certain words because I'm feeling that could come up just as a reminder.
Yeah. So censorship is a thing, right? So unfortunately, we can't talk about the reality of that situation. But as far as what you're saying is the test was the clean bill of health. And there is actually a lot of evidence, and that's what I was saying about the cardiac stress test. Does not tell you if you have heart disease or not. It's really not a good test, especially in women. In women, it's practically useless unless they have really severe heart disease. So yeah, those tests aren't very useful. So you have to take the test as, what is it looking for? What is that test looking for? So if you're doing a treadmill test, for example, at that moment on the treadmill, you didn't have any spasms of your arteries, you had good blood flow, and everything was working just fine. The next day, you could have a clot in your legs, it goes up into your lungs, plugs up your lungs, and you could die. So it doesn't mean that you're not gonna die. And then the congestive heart failure issue, also a different issue. The test isn't looking for that. It doesn't test for that. It's looking for, is there any EKG changes with exercise? So, a clean bill of health doesn't mean a clean bill of health. It just means it's very specific to that one little thing that it's testing for.
Okay. All right. Thank you so much. We went over a little bit.
Welcome.
Thank you. Those were good
All right.
questions. We'll see you next week. Thank you, Cheryl. We're off to our next meeting, so we will see you guys soon. Thanks for tuning in today. Bye-bye.
Love to see all you here. Bye.
Yes.